So, in this session, I'm going to discuss something on time dependent and rate dependent properties of a connective tissue. So, creep, the force applied to the material maintained at the same level, force remains same, the deformation increases, and the constant force but changes. Stress relaxation. So, this is one of the very important mechanical property. The tissue is getting stretched to fixed length, where the force is required to maintain that will be decreased, but the length remains the same. Hysteresis. During the application of load, whatever load we are going to apply is going to get back. Then the load deformation curve do not follow the same path. So what will happen? Not all energy is being gained, so most of the energy is lost. So in that case, there is a hysteresis loss, nothing but the form of heat loss. General changes of connective tissue due to injury, disease, immobilization, excessive use. Changes in connective tissue, especially so due to disease. So whenever there is a disease, what condition is very commonly musculoskeletal condition, the synovial membrane is affected by disease like rheumatoid arthritis, synovial fluid changes will take place. So loss of lubrication, there's an articular degeneration takes place. So there's a subchondral sclerosis is the end result. In OAs, cartilage splitting, erosion occurs, friction between the joint surfaces. Due to injury, compressor loads to the tissues surrounding the joints that may be angled. So there's any deviation in the bony components, that is partial deformity, and either the malalignment, this is going to cause injury to the tissues. Immobilization. Connective tissues, whenever there is an immobilization or it is getting immobilized for a long time, it is getting few changes. So immobilization can be done by cast, bed rest, weightlessness, pain, and inflammation. So immobilization effect on ligament and tendon. So decrease load on the ligament and tendon, decrease collagen content. So this makes the tissue weak. Normal loading, that is going to cause stress and strain. And ligaments and tendons show a 50% decrease in tensile strength and stiff form after 8 weeks of immobilization. Recovery of ligaments and tendons are slow. Recovery approximately 12 to 18 months. Immobilization effects on articular cartilage and bone. Not only the soft tissue immobilization, so even the articular cartilage is subjected to some changes, mainly the adhesion formation. So atrophy changes in the articular cartilage. So proteoglycan's content is getting reduced. There's an increase in the water content. Articular cartilage, it becomes very soft. So the next is the articular cartilage. The joint is unable to function normally. It's high risk of lesion injury. Loss of sarcomere in series, decreased contractile proteins. Exercise on connective tissue. So exercise have an effect on cell shape and physiological functions on all the connective tissues. Effects depends on the type, frequency, and amount of loading in tissues. Higher the magnitude or sustained loading will induce fibrocartilage formation. Tensile loads induce tissue formation, something like that. The following. Bony changes on exercises, bone deposition will come down. So what will happen as the exercise when you do, the bone deposition is getting increased. Medium magnitude, high frequency vibration has been shown to increase the pathway. Mechanical signals that continue barrage the skeleton. Cartilage changes, yes, of course. When you do exercise, the compressor loads are going to get there in the cartilage strength. But actually, the research says that there's no quantitative data available that changes in human arterial cartilage after immobilization and exercise. Tendons, increase in the tensile loads. The tensile strength increases. 12 months of physical training increases the tensile strength of the tendons, causes tendon hypertrophy, increased cross-link. Ligament changes on exercises. So effects of exercise in preventing negative changes in healing ligaments and positive effects on activity on ligaments, healing, all will be demonstrated. Recovery of normal ligament structure and mechanics will be after immobilization. Overuse, sudden application of large loads and sustained application of low loads. When a structure is subjected to new loading of already deformed tissue, the tissues may enter the plastic range and undergo microfailure. Cartilage are subjected to constant compressor loading will creep. Becoming thinner may show evidence of permanent deformation. So loss of ACM, increased load on the posterior D joint capsule may cause plastic deformation, leading to increased hypermobility. So this is all very clinically important. Overuse. Whenever you see overuse in a repetitive strain or repetitive motion, so that may cause this disorders. Entering into classification of joints and biomechanics. So there are various classification of joints. You have fibrous joints, cartilage joints, synovial membrane. So fibrous joints, you have sutural joints. Example, plain fibrous joints, squamous, serrate, okay, dentate, and skin dialysis, gomphosis, and syndesmosis. Coming to the cartilaginous joints, we have only two. One is primary cartilaginous, secondary cartilaginous. Synchondrosis, symphysis. Synovial, that is synovial joint, we also know is a diarthrodial joint. It is a plain synovial joint, hinge joint, pivot, bicondylar ellipsoid, saddle, ball and socket. Coming to the synarthrodial joint, synovial, these are the features. So fibrous joints, they are fixed joints. Suture joints, this is the example of suture joints. Coronal suture, you have your squamous suture, lambdoid suture. Count forces, it's a very good example is your teeth. Syndesmosis, intraosseous membrane, your radial joints. Amphioarthrosis. Amphioarthrodial joints, the primary cartilaginous, synchondrosis, secondary cartilaginous, symphysis. So rib joints are the examples for that. Symphysis, pubis symphysis, we all know pubis symphysis is a secondary cartilaginous joint. Synovial joints. Synovial joints, we have plain synovial joint, hinge joint, a pivot joint, condylar joint, ball and socket and saddle. So example, so plain synovial joint, we have your plain synovial joint, mandibulosternal, sternum, okay, acromioclavicular joints, they are all plain synovial joints. Hinge joint, elbow joint is a hinge joint. Condyloid, we all know, radiocarpal joints, radius ulnar the scaphoid. So wrist joint is a condylar joint, pivot joint, atlas and axis. Saddle variety, the carpometacarpal joint of the thumb. Ball and socket, hip joint, shoulder joint. The features of diarthrodial joints, also known as synovial joints. Joint cavity, it has a very peculiar features. That is joint cavity, joint capsule, synovial tissue, synovial fluid, hide and cartilage. So joint capsule is thin and in few joints it is thick. Joint capsule is loose and weak in certain areas. So main function stability. So joint capsule composed of outer stratum fibrosum, the inner stratum synovium. So stratum fibrosum sometimes referred to as fibrous capsule composed of dense fibers or dense fibrous tissue. Water, 75% of the water in the tissue are the weight collagens, the elastin, and other 90% is dry weight. Type 1 collagen is very predominant in the joint capsule. Synovial fluid, the fluid that helps the prevention of friction between the joints, it's very important. So it reduces joint, it improves the joint lubrication. Provides nourishment to hyaline cartilage. Hyaluronic component of the acid, it's very important, hyaluronic acid. Response for the viscosity of the fluid, response for joint lubrication. Lubricant, that's very important, that takes care of the cartilage on cartilage lubrication. Fluid is very pale yellow, viscous fluid. Joint lubrication are two types, boundary lubrication, fluid film lubrication. Boundary lubrication occurs with each load-bearing surface is composed of a thin layer of large molecules. Human diarthrodial joint, these layers contain the lubricant that adheres to the articular surfaces. Lubrication depends on light irregularities of the joint surface that trap the hydrogen. Lubricant molecules to create a fluid film over the cartilage surface. Elastic deformation of the cartilage to maintain a layer of fluid between opposing cartilage surfaces. Fluid being squeezed out of cartilage into the joint space. Subclassification of diarthrodial joints. We have various classifications: uniaxial, biaxial, and triaxial. Uniaxial, single plane, single movement. That's very important. Biaxial, two planes, two degree of freedom. Multiplanar, triaxial. So uniaxial joint, multiaxial, biaxial. These are the things. What is degree of freedom? Degree of freedom, the joint is the number of independent movement that takes place. Coming to the kinematic chains, very important, there are linked joints. The kinematic pairs are coupled in such a way that the last link is joined to the first link to transmit different motion of the kinematic chains. So open kinetic chains and closed kinetic chains. When the distal joint is free to move, then it is an open chain activity. The distal joint is subjected to link to the other few adjacent segments. So then it is a closed kinetic chain. So these are the few examples of open chain and closed chain. So open chain activity, closed chain activity. Coming to the osteokinematics and orthokinematics. So it refers to the roll and glide. We already discussed in the first chapter the translatory motion, the rotatory motion. The translatory motion and rotatory motion. The rotatory motion that moves the bones on space during the physiological joint functions. So these motions we call as osteokinematics. Orthokinematics are movement that takes place, an accessory motion that takes place in the joints. The roll, glide, and spin. So this is an example of a very important. So see the talus moves on the as an ankle mortis, the distal tibia. So this is a gliding takes place here. Again, You have few movements that takes place in the ball and socket joints. Roll, glide, and spin. So these are the orthokinematics movement. What is roll? Rolling of one joint surface on another. So the tire rolling on a road, how it rolls. So femoral convex rolling on a fixed tibial surface. Glide, pure translatory motion, gliding of one component over another. Brake wheel skids on the road. So that's going to be a glide. So glide is another orthokinematic motion. Spin, rotatory motion, spinning. Okay, point of contact keep changing for the motion moving component. So it spins. Convex concave roll. So that's very, very important. So when the convex surface moves on a concave surface, rolling and gliding, so what happens? The direction of gliding, direction of rolling. It's very important. So one bone, the concave is fixed, the convex is moving, rolling and gliding takes place in the same direction. Okay, I'm sorry, it takes place in the opposite direction. Gliding of the one surface, bone. So orthokinematics, the roll and glide takes place in the opposite direction. Then the concave moving on a convex, then the roll and glide takes place in the same direction. Okay, so this is the thing. So this is very important about convex concave rule. So once again I repeat, convex concave rule. Then a convex surface moving on a concave, roll and glide takes place in the opposite direction. When the concave moves on a convex particular surface, the roll and glide takes place in the same direction.